Good afternoon. My name is Sabrina Harris, and I will be presenting to you all the dynamics of community and public health. I am taking class HCA 415, Community and Public Health, Professor Arazi Slayton, and today's date is October 12th, 2015. My thesis statement and what I'm trying to get you all to understand is that community and public health are detrimental to the healthcare system as a whole because it is open to all and it provides information as well as healthcare to a community and or the art of population health and not just individuals. It sees the need to improve and or prevent according to epidemics and not just focus on primary care, although it could be offered. So the role of community and public health there's a number of things depending on who you are, your stance, and where you and how you're looking or your role in the community health. One is disease prevention, and that is, of course, the prevention of diseases, whether it's infectious disease and or a chronic disease. And that includes HIV, diabetes, high blood pressure, etc. Another role of community and public health is to improve health, just like any healthcare system or healthcare provider, to improve health. That includes vaccines, flu shots, health checkups, BMI, weight checkups, to improve health altogether. Another role is to monitor health conditions. If a flu outbreak happens or occur in a part of a city or a community, they are there to monitor it. Community and public health are around, and they keep up with census reports. They keep up with disease reports. They keep track of certain diseases and what's going on in the communities in order to monitor the health conditions of the community. So the local health department basically has all, I wouldn't say names, but they can, in every community and or county, they can roughly know or see how, keep up with how many people have certain diseases, how many people are at risk, because they keep up with numbers and things like that. They investigate diagnosis, which goes along with monitoring health conditions, as well as educate and inform the people of the community, each other, physicians, nurses, and or the community and public health. Public health has an organizational structure with anything that's solid and stands. There's going to be an organizational structure. With that being said, there are 3 categories with subcategories. And the one that falls under the public health is, of course, the director of public health officer, and then the chief deputy director of policy and programs. And they have 5 different programs. The first one is the Center for Chronic Diseases Prevention and Health Promotion. Basically, what that center does, and or that group or aspect of the public health organization, they basically deal with chronic diseases and prevention, and or to care for those who are diagnosed with those diseases, such as diabetes, high blood pressure, just chronic diseases, not necessarily stuff that you can spread. The Center for Infectious Disease, CDC, is for infectious diseases such as HIV, sexually transmitted diseases, hepatitis, things that can be passed on, and that's infectious. So diseases that's not necessarily, diseases that you can give to someone else. The third one is the Center for Environmental Health. Basically shows how the environment affects health, and that's what environmental health is. Basically, people smoking, secondhand smoke, that's all about the environment. Someone with asthma is living in a place with there's a lot of pollen. You're talking about lead poisoning, just different things like that the environment affects the health. The Center for Healthcare Quality, no matter where you go, whether you go to a public health organization, a private health organization, a state health organization. Everybody is looking for quality health care, whether you have insurance or you're uninsured. The last one is the Office of Obesity and Nutrition. We all know we live in the United States, and that's a major issue here. And the Office of Obesity and Nutrition offers support as well as information in order to prevent obesity and to give out proper nutrition tips and or assistance on those who need it, to those who need it. Public health law, they have three. The first is the police power. And basically what the police power is, it regulates and enforces order within the U.S. when it comes to keeping the citizens healthy and safe. And an example of that would be the Ebola breakout. They had to quarantine those patients who had Ebola so that it can keep the rest of the people of the community safe. Disease and injury and prevention. That one is basically enforcing agencies to take action in order to prevent disease and or the spread. For an example, vaccinations. They give out vaccinations so that, people won't get sick, people and kids won't carry diseases. And a really good example, some people don't believe in vaccinations, but in order for your child to go to public school in the United States, they are required to have a few vaccinations. Let's just say someone lie on the application and say, yeah, or falsify immunization records. Falsify immunization records and say, well, my child received a vaccine, and if they didn't, and they see that, you're liable to go to jail. So, yeah. And last but not least is the law of population. Basically, the growth of population, making sure that public health can keep up with that. Sometimes they increase, and of course, it's always increasing because babies are being born every day. But with that being said, it's just basically making sure that they can keep up with what's going on out there in the populations. Ethical measures is exactly what it is. Everyone is basically lives by an ethical standpoint or morals. One is quality. Everybody wants quality health care, as I said before, whether you're insured or not insured. You want to make sure you're going to a physician and or a place of health care that knows what they're talking about, and they are able to provide quality health care. Accountability, you want to make sure that doctor is really licensed, and when I say you, not necessarily you in the room, however, what patients is coming in. So they want to make sure that doctors and physicians and anyone who works under that umbrella is accountable. Justice, to make sure everything is fair and everybody's treated equally. Flexibility, making sure that, the doctors can keep up with the patients, and the patients are, have, not necessarily doctors, but the patient have access to the things that they need, as far as brochures, condoms, flu shots, you name it. Engagement is really important to build, to engage with the community, to engage with each other, the patients, the physicians, the nurses, the social workers, everybody that's on a team, because that will help build meaningful relationships. Funding. So all this information, all these brochures, all of these flu shots, these vaccinations, where are we getting the money for this? Well, a lot of times you receive grants, and that comes from the government, of course. The government set aside a certain amount of money to help out with different things that's going on in the community, such as public schools, public health, and so forth. Donations from physicians, surrounding hospitals, prominent members of the community activities, as far as, walks. Sometimes they have walks, and community activities and fundraisers go together because they could have a huge celebration, and there'll be vendors there who's paying to get information out, or there'll be booths set up, or the cancer walk, and or the obesity walk. They have walks in different activities for different diseases and or things going on in the community, and that's another way to bring awareness as well as to get revenue. The importance of communication. You want to build rapport with the community. You want to make sure that the community feels comfortable coming to the facilities and the places and or establishments that you have. Educating is an importance of communication, because you want to know what you're talking about. Physicians as well as nurses, staff, you want to be able to have a conversation and keep up with the patients and their needs. So you got to be able to educate them as well as educate yourself. And you can't educate patients without having great communication skills. Prevention, you want to be able to show the patient and the community that you can prevent things from happening. What other way can you do that without telling them and showing them? And communication is not always mouth to mouth. It's brochures, having things on hand that you can give out to patients and or people of the community, having resources where they can come and get assistance and help. Communication is important for promoting, and that's promoting health, good health, as well as the establishment, as well as different healthcare professionals that may see patients for different things. If a patient come in to a healthcare professional and they're standard and they need an eye checkup, or they're going blind in one eye, you want to be able to have an open communication where you can refer your colleagues and or another healthcare professional. You can't do that without having good communication skills. And lastly, in order to gather information, you have to be a good communicator, because you have to get information and retrieve it, as well as send it and give it out. Here are my references, and you all have been so great. I really appreciate your time. Thank you.